Hi everybody, Dr. Nikita Vizniak, and I am here with the amazing
Dr. Chung.
And we are going to show you some cervical adjusting techniques that you can use from a larger practitioner who's 6 feet tall and 180 centimeters.
And a 5-foot practitioner that is 150 centimeters.
Yeah.
And other than, you're like, just how is height anything to do with cervical adjusting? Because like you roll your body's into it. Look at the hand size difference. Like that is just the biggest thing if you'll see here. And that's how the techniques are going to be a little bit.
What I find interesting, even just Catherine, to stand up behind the table just so everybody can see that. Yeah. Okay. Because this is me sitting down, and it's like that's the height difference right there, right? So yeah. All right. So we're going to go ahead and we'll start with some basic cervicals. We'll just start with a simple index pillar push. I'll go through first and just do a quick demo of kind of the basic techniques that I'll use, and then Catherine's going to show us some variations that she'll use within that. So, Dr. Chung, if we can, we'll have you lay down. So to begin with, you've already gone through your assessment. You know the listings that you want to correct. We're just going to use a simple index pillar push. There's a couple of things that you can do to increase your success with this adjustment. Number one, how you approach the table actually does make a big difference. Generally, I like to approach at roughly 45 degrees like this in a nice neutral stance. And what I mean by that is more of an athletic stance where my knees are bent. I'm ready to move around from here. I see a lot of students when they first do this, they stand fairly upright and they hinge over at the hips like this. That takes away most of my leg strength if I do that. So bend the knees, getting low. I'm wearing this tie for a very specific reason so we can actually see sternum over top of contact. If you can follow that principle, it will be easy for you as well. First thing you do is you shake hands with the ear, and then you turn the patient's head away just a little bit. You do not want to over-rotate the head here. If I rotate the head too far, it's going to mean that I'm probably going to miss the end range if I do that, so I want to stop short of that. Generally, the headpiece can be anywhere from neutral to slightly flexed up like it is right here. My contact is going to be an index on the articular pillars. As long as you stay posterolateral, things will be comfortable, and I'm lifting as I'm spinning through. What a lot of students do is they come a little bit too lateral as they start to push in, and then it gets over top of your transverse processes, and nobody cares for across the transverse processes. Yeah. All right, so my tissue pull starts medial to lateral, and then I come back into the neck like this. My thumb is up. You can rest it over top. A lot of people think that they're choking somebody when they're doing this. It's just resting there, so it doesn't feel like that for most patients. So my tissue pull is across. Now, for this to be successful, the best thing that I know how to do is use my body weight to advantage. So that means I've got to be up on my feet, my knees are bent, and my sternum is over contact. Have I mentioned that yet? Sternum over contact?
Maybe once or twice.
Once or twice, yeah, just to make sure, right? Okay, so we go ahead, start our tissue pull, and I start to rotate her body around. And look at my hips move to spin her around right here. And I'm actually just stepping up and down the spine, looking for a segment that I might want to adjust on. And we'll say this one right here. So give me a big breath in, Catherine, and then all the way out. Following it through, smooth motion, wait for end range, and a little bit of overpressure at the end. Okay, so we can see that from the opposite side. We're just stepping around like this, shaking hands with the ear, turning the head away, tissue pull around, and right about there. So big breath in for me. She breathes out, following, fast move. Okay, nice shift. That would be my basic intro to it right there. Relatively simple for you to perform. If high velocity thrusting is not within your scope, you can actually do this without the high velocity thrust and use it as a joint mobilization like many of our other techniques. But so we can see a better variation right here. We'll get Dr. Chung up and she's going to demo her techniques that she likes to use as a smaller practitioner.
Right. So this is like the thumb pillars and stuff? Or
you can do the same thing. You can do the same thing and then do a thumb pillar if you want. Yeah.
Okay.
Yeah.
Sounds good.
Yeah.
So as a smaller practitioner, the best advantage that I always found as a smaller practitioner is their smaller hands. And it's great because you can find little nooks and crannies that you can actually hook into that it makes it way more specific than someone with larger hands.
And that's what I want to say for sure, is actually smaller practitioners tend to be better adjusters because they have to use more finesse and less power to do it. So. Okay.
So the setup is going to be exactly the same as any regular sized or taller practitioner. So you're just going to find where there is a fixation. So then you're going to shake hands with the ear. I tend to be a little bit more anterior because my hands are smaller. I tend to be a little bit more anterior. I find that if I'm too posterior like this, then when you set up, then the head either falls over or you end up adjusting more into extension like this. So a lot of the times when I'm correcting a lot of students that are smaller in frame, I get them just to be a little bit more anterior, and then this will give you a lot more control of the head.
Yeah, and I'll just make one comment on that as well. Even when you come around, like you can see her fingertips, they are hooking into the back of the occipital bone, so I feel balanced right there. So when she brings me over, my head feels in a good place, like I'm going to be able to relax there. So likelihood of guarding is going to be way lower for the patient.
And even for you, because when you're adjusting, you have to have very relaxed hands. And when you know that your patient is supported, especially a vulnerable space like their head and neck, then you will be more relaxed as well.
Yep.
So then one thing that I do, and Dr. Nick calls me on this all the time, when I like to end up tricking my students a little bit in terms of my body movements. And the reason why I end up moving my hips a lot more than what say Dr. Nick does, is just because I like to use that kinetic energy and use that flow and that movement to really help guide my adjustments versus having to be here and then just adjusting. So when I'm adjusting, I tend to start more on the caudal side and then just really step into it, so then I just get the flow of the hip movement there. So with Dr. Nick, there's one here. Is it okay if I adjust?
Yep.
So that you can take a breath in and out. Good. Right there.
Nice.
Perfect.
Yeah. So you can see her technique is she starts a little bit further out, and she definitely has excellent speed with that, right? And very specific adjustments. So yeah.
Exactly. And then another way that I like to adjust is using actually my thumb rather than my index finger to actually adjust. And it's pretty much the same adjustment. It's just that you're using your thumb to hook forward rather than using your index finger to then hook and then thrust through. And I find this adjustment maybe a little bit easier to visualize because I can just follow my fingers and I know that I'm rotating and the vector is going to be in the right place because I can just follow my fingers through rather than say just my thumb. The thumb kind of throws me off a little bit sometimes.
All right. Yeah. It's whatever works.
Yeah.
Okay.
So with this one, it's going to be exactly the same, where you're going to shake hands with the ear here. The only difference is, so the index pillar, maybe I'll do it on this side. So the index pillar is using your index finger, and then you're doing a posterior to anterior tissue pull, and then a medial to lateral. No, a lateral to medial, sorry. So then with the thumb pillar push, what you're doing is you're just reversing your hand, and then you're using your thumb, doing a posterior to anterior, lateral to medial, and then you're going to step in and you're going to do an adjustment going this way. And I like to rest the fingers onto the jaw here just so that I have a little bit more control of the head and how the head is rotating as well.
Yeah, and a big point to make on that, so go ahead and set it up, Catherine, that's good. So she's set up with the thumb across, so she's got her fingers resting on the jaw like this. I just want to make sure the upper camera can see. Yeah, she's got her fingers resting on the jaw like this. She's not pushing hard on the jaw, she's just resting her fingers there. That's the key thing.
Yeah, there's no blanching of the fingers here, it's just nice and relaxed. So, can I adjust this segment right here?
Absolutely.
Perfect. So we'll get you to take a breath in and out.
Nice.
Nice adjustment right there.
Really good.
Good. Perfect.
Yeah.
Good.
Okay. The awkward end. All right. Okay, that's cool.